Assalamu alaikum. This is Jahangir and you are watching Medical and Nursing Lectures. Dear learners, today we are going to present some MCQs regarding Fundamental of Nursing. So here the question number 1. Pain resulting from the stimulation of internal organs is called option A. Superficial pain, option B. Deep or visceral pain, option C. Referred pain, and the last option is radiating pain. So here the correct option is deep or visceral pain is the one which is arise from the internal organs. So here question number 2, how many hours of sleep should teenagers be getting per night? So here are some options. Option A 5 to 7 hours, option B 8 to 10 hours, option C around 11 hours, and the last option is more than 11 hours. So normal sleep for the teenagers is 8 to 10 hours. The correct option is option B. You can see here that the normal sleeping hours for the teenagers is 8 to 10 hours. Question number 3. When giving a client diagnosis of acute pain, the nurse using NANDA nursing diagnostic categories will use this diagnosis only when the pain lasts no longer than which of the following length of time? Option A 3 days, option B 1 week, option C 1 month, and the last option is 6 months. So here the correct option is option D 6 months. If you compare acute versus chronic pain duration, so here you can see that the duration of chronic pain is more than 3 months. So the option D would be the correct one. Question number 4. When talking with a client with a complete and incomplete proteins. So the option A is olive oil, option B eggs, option C nuts, option D is rice. So here the correct option is eggs. Option B is the correct one. You can see here in the picture that the yolk, which we call the yellow of the egg, contains protein 2.5 gram and white of the egg contains protein 4 grams. Question number 5. In instructing a client on cholesterol, the nurse will teach which of the following things? Option A. The body does not need cholesterol. Most cholesterol in the body is destroyed in the small intestine. Third option is the majority of cholesterol in the body comes from eating fatty foods. And the last option is most cholesterol is synthesis in the liver. So here the last option is the correct one. Question number 6. In the daily practice of nursing, nurses use critical thinking and option A, setting priorities of the day, option B, every decision that is made, option C, calling the pharmacy for medications, and the last option is checking supplies in the client room. So here the correct option is setting priorities of the day. Question number 7. The lowest level of needs in Maslow's hierarchy of needs is which of the following? Option A, safety and security needs. Second option is love and belonging needs. Option C, physiological needs. The last option is self-esteem needs. So here you can see in the picture that the last of the lowest need of according to the Maslow hierarchy is physiological need. So here the correct option is option C. Question number 8. What is the term used for normal respiratory rhythm and depth in a client? So here are some options. Option A, apnea, option B, apnea, option C, bradypnea, option D, tachypnea. So here the correct option is apnea. Question number 9. All of the following are the indications of massage therapy except Option A, decrease of muscle soreness and stiffness. Option B, moderation of pain. Option C, facilitation of relaxation. And option D, contagious disease. So here is that in contagious diseases we cannot use massage therapy. So the option D is the correct. Question number 10. Which action should the nurse take before administering morphine 4 mg intravenously to a patient complaining of incisional pain? Option A, assess the patient's incisions. Option B, clarify the order with the prescriber. Option C, assess the patient's respiratory status. Option D, monitor the patient's heart rate. By the way, all of the options are correct, but the best option here is option C, assess the patient's respiratory status, because all the anesthetic drugs depress the respiratory status of the patient. So here the correct option is the option C. Most common side effects of opioids is option A, respiratory depression. Option B, nausea and vomiting. Option C, diarrhea. Option D, tolerance and addiction. So here the correct option is respiratory depression. Question number 12. The modulation of pain involves changing or inhibition transmission of pain impulses in the spinal cord. Which of the following neurotransmitters helps in modulation of pain? Here are some options. Option A, endorphins and enkephalins, which are called also endogenous opiates. Option B, serotonin. Option C, GABA. Option D, all of the above. So here the correct option is all of the above. As you know that in modulation of pain, all these neurotransmitters play their own role. Question number 13. Sleep promoting neurons act or wake promoting neurons by the release of option A, endorphins and enkephalins. Option B, serotonins. Option C, GABA. And option D, all of the above. So here the correct option is GABA, a neurotransmitter in the brain that has a calming effect. Option C is the correct one. Question number 14. With the beginning of daylight, which hormone is at peak to cause awakening? Here are some options. Cortisol, melatonin, serotonin, and the last option is GABA. So you can see here that with the beginning of daylight, the level of cortisol is very high. So here the correct option is option A. Question number 15. A smoker patient is complaining for the easily arousal from sleep. The nurse understands that this can be due to the increased level of which drug? Option A, caffeine. Option B, nicotine. Option C, morphine. And the last option is none of the above. So here the correct option is nicotine. Question number 16. Which of the following is the most common complaint of sleep? Here are some options: insomnia, narcolepsy, hypersomnia, and sleep apnea. The correct option is insomnia. Question number 17. A patient with apnea came to the hospital. Which of the following question is most appropriate to ask by the attending nurse? Option A, do you have any cardiac history? Option B, have you taken your sleep pills? Option C, do you have difficulty in sleep while sleeping? Option D, have you ever had kidney pain? So here the correct option is option C. Question number 18. A rectal suppository is used to treat a fever. This would represent what type of drug delivery? Option A, parenteral and local. Option B, parenteral and systemic. Option C, enteral and local. Option D, enteral and systemic. So here the option D is the correct one. As you know that fever is systemic and the route which we are using is enteral route. Question number 19. Which of the following is not the route of drug administration? Intravenous, intramuscular, subcutaneous, and dissolution. So here the correct option is dissolution. Question number 20. Which route is affected by first pass metabolism? Here are some options: oral, intravenous, intramuscular, and subcutaneous. So first of all, we should know about the first pass metabolism. When a patient takes medication through oral route, that medication go down to the stomach. From the stomach, that medication go down to the duodenum. Then medication get absorbed by the hepatic portal vein, which lead to the liver. In the liver, medication get metabolized by an enzyme which is called cytochrome P450. So the metabolism, this kind of metabolism occur with the drugs which is taken by oral route. Intravenous, intramuscular, and subcutaneous medication do not go for the first pass metabolism, because these medication directly absorb in the blood. So here the correct option is oral route. Question number 21. Which of the following is the fastest route of drug administration? Intravenous, intramuscular, peroral, and subcutaneous. So here you can see in the picture that intravenous take 30 to 60 seconds for its onset of action. So here the correct option is option A, intravenous. Question number 22. Which of the following is the primary organ associated with drug metabolism? Here are some options: the liver, the brain, the kidney, the spleen. So here the correct option is the liver. Question number 23. A middle-aged woman's father has passed away, and her mother requires physical and emotional help due to disabilities. The woman is married and raising 2 children along with working full-time. All of the factors described are stressors, demands, illnesses, stimuli. So as you know, all of these are stressors. So here the correct option is option A. Question number 24. Which of the following is a physiological response experienced during the exhaustion stage of general adaptation syndrome? Here are some options: increased mental alertness, vasoconstrictions. Option C, the initiation of neuroendocrine activity. The last option is decreased blood pressure. So here the correct option is decreased blood pressure. Question number 25. Which of the following can happen during stress condition? Constipation, diarrhea, mouth dryness, all of the above. So here the last option is the correct one. Question number 26. A middle-aged woman is experiencing signs and symptoms related to stress after the expiry of her baby. This is known as anxiety, depression, post-traumatic stress disorders. None of the above. So here the correct option is post-traumatic stress disorder. Question number 27. You may worry when faced with a problem at work, before taking a test, or before making an important decisions. The next term, this is a anxiety, stress, post-traumatic stress disorder. The last option is all of the above. So here the correct option is anxiety. Question number 28. Patient asks the nurse what vitamin is best for eyesight. The nurse responds that vitamin A, vitamin C, vitamin B, vitamin E. So here the correct option is vitamin A. Is you know that vitamin A having a good role in the eyesight. Question number 29. The most preferred intramuscular injection site for children and infants is deltoid site, nasogluteal site, ventrogluteal site. The last option is vastus lateralis site. So the correct option is option D, vastus lateralis site. Question number 30. Insomnia means inability to walk, unconsciousness, inability to sleep, inability to eat. So here the correct option is option C, inability to sleep, which is also called no sleeping complaint by the patients. Question number 31. Involuntary passing of urine is known as enuresis, elimination, micturition, defecation. So here the correct option is option A, enuresis is called involuntary passing of urine. Question number 32. The enema given to relieve gaseous distension is combinative enema, cold enema, antihelminthic enema, purgative enema. So here the correct option is option A. Combinative enema is given primarily to expel flatus. The solution instilled into the rectum in the colon that stimulate peristalsis. So here the correct option is option A, combinative enema. Question number 33. Term melena means dark colored stool containing blood. Option B, pus in the urine. Option C, painful micturition. Option D, sugar in the urine. So here the correct option is option A, dark colored stools containing blood. Question number 34. All of the following are the responsibilities of a patient except following the hospital's rules and regulation, providing information, give different kind of care. Option D, complying with instructions. So here the correct option is option C, give different kind of care. This is not the responsibility of a patient. This is the responsibility of a nurse to give different kind of care. Question number 35. What is anticipatory grief? Option A, grief over your own death, grief on the loss of others, grief for upcoming loss, fear of loss. So here the correct option is grief for upcoming loss. Option C is the correct one. Question number 36. When providing nursing care during the dying and grieving process, nursing interventions should target all of the following except energy conservation, pain reduction techniques, comfort measures. Option D, increase self-esteem through cosmetic improvements. So here option D is the correct one. Question number 37. Suicide will sometimes result in what kind of grief to loved one? Select the best answer. Delayed, exaggerated, disenfranchised, masked. Correct option is option B, exaggerated. Question number 38. A deliberate action taken with the purposes of shortening life to the suffering or to carry out the wishes of a terminally ill patient. Option A, suicide. Option B, euthanasia. Option C, coupe de grace. Option D, coupe de fille. The correct option is option B, euthanasia, also called mercy killing. Question number 39. Many changes occur after death. Rapid cooling of the body is one of them. It is termed as rigor mortis, rigor mortis, livor mortis, all of the above. So here the correct option is option A, rigor mortis. Question number 40. This phase is characterized by sexual fantasies and the feeling to have sexual activity. Option A, orgasm. Option B, desire. Option C, resolution. Option D, excitement. So the correct option is option B, desire. Question number 41. If ejection does not occur during the sexual response cycle, it may take days hours and may be associated with the irritability and discomfort. Here are some options: 6 to 8 hours, 2 to 4 hours, 1 to 2 hours. The last option is 2 to 6 hours. So here the correct option is option D. Question number 42. In disorders of sexuality and sexual functioning, the term gender identity disorders refers to option A. Problems with the normal sexual response cycle. Option B. Sexual urges or fantasies involving unusual sources of gratification problems. Option C. Problems with sexual fantasies. The last option is an individual is dissatisfied with their own biological sex and have a strong desire to be a member of the opposite sex. So here the correct option is option D. Question number 43. In disorders of sexuality and sexual functioning, the term paraphilia refers to problem with normal sexual response cycle, problem with the sexual fantasies, sexual urges or fantasies of unusual sources of gratification, an individual dissatisfied with their own biological sex and have a strong desire to be a member of opposite sex. So here the correct option is option C. People victim of paraphilia having sexual urges or fantasies of unusual sources of gratifications. Question number 44. The practice of adopting the clothes or the manner or the sexual role of the opposite sex is termed as intersex, transvestism, transsexualism. The last option is both A and C. So here the correct option is option B. It is called transvestism. Question number 45. Attending nurse is noticed that the client is in hypotension. The nurse thinks that the following position would be better to restore the blood pressure of a patient. Option A. Forward position. Option B. Supine position. Option C. Prone position. Option D. Trendelenburg position. So here you can see Trendelenburg position. In Trendelenburg position, the blood flow towards head get increased. So the correct option is Trendelenburg position. Question number 46. Which of the following is the example of chronic pain? Arthritis, appendicitis, cuts, and burns. So here the correct option is arthritis. Question number 47. Which position should be given to improve oxygenation and respiratory mechanics of a patient? Supine, prone, right regular, and the last option is Trendelenburg position. So here the correct option is prone position. Thank you for watching. Please subscribe our channel and press the bell icon.